You can see me, but I can't see you. I'm Leslie, and I have quite a history. I don't have to use 23andMe to find out that I have genes that means you're going to have open heart surgery. My mother died right after open heart surgery. My father died right after open heart surgery. My mother's mother died of a heart attack. My father's father died of a heart attack. I have 5 brothers. 3 of them have had open heart surgery. 2 have not, so 2 passed. Didn't need 23andMe. My experience was a bit different than many people because I worked in open heart surgery with patients, and I was very aware of what was going to go on. About 10 years ago, I had a friend who used to do echograms, and I said, will you look at my mitral valve prolapse, which I had since I was born? She says, oh yes, Leslie, it's wrinkling up. You will need a new one someday. I said, okay. Yet I had great confidence in the heart surgeons and in the hospital. I had no concerns. A plus that Abbott Northwestern used to have, and I don't know if they still have it, but I wish they did. There was a whole team where we would take patients coming in for open heart surgery to the surgery room so you saw the whole room where you would be going, and was educating them, except for my dad. My dad did not want to know anything. And that is something you learn in counseling. You respect and listen to where the person wants to be. I had open heart surgery when I was aware that I started to lose my breath. I would be walking in work and I'd stop and I'd go, well, I know I'm going to need open heart surgery. It came to the point where I couldn't get into my car, so I sat there for a while. My oldest son was over and he says, Mom, you keep losing your breath. I said, I'm okay, I'll be fine. Until one day, I came up the stairs, I sat on the chair, and I said to Ben and his wife, I says, okay, now it's time to go. In I went. I did not have to make decisions because I already understood what was going to happen. When I went in, they decided open heart surgery. Then I had a stroke. They did it. It was a mild stroke. They waited another 7 days because my thyroid was a mess. They began open heart surgery. I had mitral valve prolapse. I had both valves replaced. I also had vascular disease. Vascular disease became relevant 2 years after my open heart surgery. It begins to block, close up your arteries in your legs, although you can get better from it. The legs have the ability to create more arteries, or your muscles learn how to work with it if I exercise. And so I do. I still have the pain, but I continue to exercise. The one thing I would encourage all of us to do, whether you suddenly have a heart attack and you're totally unknown about what's going on in this world, I would beg of you, because I used to say to doctors when I was with them with patients, the doctors would talk in doctor language. How many of us understand doctor language? I don't. And I would turn to the person and I would say, would you please explain to Susan what that means in plain language? And I would bring that up. I would encourage anyone, if you have family members, or even when you go in to see your doctor, they're using words you do not understand, just please explain to me what you mean by that. For example, I had my primary care doctor said to me once, well, we're going to put this pill you've been taking on vacation, on holiday. I said, what does that mean? She says, that means you're going to stop using it for a while. That's doctor's talk. So even a simple thing like that, take responsibility, understand, I do, what are the side effects of my medications? What are the positive sides? When I got training, 600 hours in hypnosis, that psychologist consistently said, if no one takes care of you, no one else will. Even if you have a wonderful partner says, now honey, please do this, please do that. I have to choose to do it or choose not to do it. You are the most important person to you. If you don't take care of you, no one else will. I've been doing very well. I now work out. I do Pilates, I do yoga, and I do the cardio. For a while, I was not. I was very depressed. I was in the depressed category for about a month and a half to 2 months after my open heart surgery. Because I spent a month and a half in the hospital. I had had a second stroke, and then I was in rehab. So I was not able to leave as quickly as everyone else. That took me quite a while. I also had the fear and concern of I can't write like I used to because my stroke has affected my right side. You can't see it, but I'm aware of it. I can't write like I used to. If I write someone a note and I'm doing it quickly and I look at it, I go, okay, I know what that means. A half hour, I come back and I don't know what it says. So I've learned how to print. I trust each one of you here, as well as myself, that you will do the best you know how to do to work out and to exercise and to stay in contact with each other. Thank you so much for the time.